Happy Christmas, guys. Christmas is incomplete without this song. So in this video we'll be talking about entire all the Christmas that you see in the medicine. We'll be talking about the bells, we'll be talking about the Christmas, we'll be talking about the Santa and also the stars, the things that you see in Christmas. So enjoy your Christmas. This is a short video. Let's complete the entire topic. So it is a high revision video also. Let's get started. First is the hemophilia. So the thing that is important, that is the hemophilia B, which is known as the Christmas disease. Okay, that is due to factor 9 deficiency. So basically we have three types of hemophilia: A, B and C. Okay, A is due to deficiency of factor 8, B is due to factor 9 and C is due to factor 11. See, both of this 1 and 2 are X-linked recessive and C is autosomal recessive. So remember, like a card. Okay, C is autosomal recessive and other two are X-linked recessive. Okay, now coming on to say hemophilia. So what happens in hemophilia? You have deficiency of clotting factor either 8, 9 or 11. If you remember the shorts that I posted, okay, so we have intrinsic pathway and the extrinsic pathway. Extrinsic pathway, guys, mnemonic is PET, that is prothrombin time is for extrinsic pathway. So intrinsic pathway is APTT. So here what we will find, here we will find elevation in your prothrombin time. Okay, sorry, here elevation in your APTT, that is your intrinsic pathway ka defect. It is that is 12 11 9 wala pathway. So that is defective here. So this we have already done. B is deficiency of factor 9. C is due to 11. So what happens in hemophilia? Okay, so this hemophilia, basically there are hemorrhage, bleeding around the joint, and this is termed as hemarthrosis, bleeding around the joint. Okay, and see, then you have easy bruising, history of fatigability, bleeding after trauma, dental procedure. So even after minor trauma you will have great bleed. So this is important clinical history that you need to know. And what is the treatment? Either you can use desmopressin, or if there is hemophilia A, factor 8 deficiency, factor 8 concentrate, you have also a monoclonal antibody for factor 9 concentrate or factor 11 concentrate, depending on the type of hemophilia. Now coming on to vitamin K deficiency, guys. So we know vitamin K is important for the synthesis of clotting factor. So that is 2, 7, 9 and 10. Okay, if you see, guys, 12, 11, 9, that comes in this wala comes in intrinsic pathway, and 7 and 3, 10, this comes in extrinsic pathway. So both APTT and PT will be elevated here. And in vitamin K deficiency you have coagulation defect, because coagulation factors are deficient, and bleeding time is normal because platelets are fine, and there is a decreased activity of 2, 7, 9, 10, and also the protein C and the protein S. Now see, clotting factor 9 is important. This clotting factor 9 that causes hemophilia B is also known as your Christmas factor, your anti-hemophilic factor B, because it prevents hemophilia, and plasma PTC, plasma thromboplastin component. Now see, if this already done, hemophilia B, Christmas disease, which is a X-linked recessive disease. Okay, this is important. Treatment with recombinant factor 9, factor concentrate 9. Now moving on to the next one, that is in your dermat. Okay, so if you see the dermat, this is known as the pityriasis rosea. The patient present like this is the clinical profile of the picture. Okay, so see first this one, guys. Okay, this is basically the Hadal patch or the mother patch. Okay, so after some time what happens, it distribute in a Christmas tree pattern. If you look at the appearance, so this is known as your Christmas tree or fir tree appearance, which is seen in pityriasis rosea. Okay, again an important thing to know. Now coming on to the next one, that is in your opthal. In opthal you have Christmas tree cataract. Okay, so this Christmas tree cataract, guys, which you look at here, okay, this is the Christmas tree cataract. That is a trinucleotide repeat disorder. So now let's revise. Okay, this is seen in your myotonic dystrophy. So what is the trinucleotide repeat disorder, guys? Myotonic, that is CTG. Okay, myotonic T is coming, so the disorder is CTG. Okay, like we have other cataract like snowflake cataract in diabetes, oil drop cataract in galactosemia. These are other cataracts that you need to know. Now coming on to your trinucleotide ka repeat disorder, if we talk about. Okay, so trinucleotide repeat disorder. So what happens? This shows anticipation, that is disease severity increases and age of onset decreases in successive generation. This is anticipation, again in a PYQ that has been asked. Okay, now coming on to the some disorder that show. One was this myotonic dystrophy, that is the Christmas tree cataract wala. So that is CTG. Okay, myotonic has T, this CTG has T, other does not have any one has T. Now this Huntington disease, okay, this Huntington disease, so remember a hunter uses a case, so the mnemonic is CAGE. Okay, so this is a autosomal dominant. So how to remember? See, C Huntington, C means caudate atrophy, A means decrease in acetylcholine, and G means decrease in GABA. Very important MCQ that may be asked. Okay, which one of the following is correct for Huntington disease? Remember like this: C for caudate atrophy, A for acetylcholine decrease, G for GABA decrease. Then fragile egg syndrome, guys. We know eggs are so fragile, so egg can break anytime, guys. Okay, EGG, that is CGG, guys, fragile egg syndrome. And here you have chin protruding, C you can remember, and GG, that is giant gonads. Again a MCQ that may be tested upon. Then Friedreich ataxia. So basically a problem in walking. Okay, that is gait abnormality. So remember GAIT, will remember GAAIT. That is GAA is the trinucleotide repeat disorder. Again an important MCQ that you need to know. Okay, now coming on to the radiology. Okay, if you see this appearance, guys, okay, so this is the Christmas tree appearance that is seen in your neurologic bladder. So what happens in your neurological bladder means this bladders become extremely excitable. Even a small amount of if urine collect there, okay, they will elicit the uncontrollable micturition reflex. As a result, patient will have frequent micturition. Again an important point to know. Okay, then this in biochemistry, if we talk, this neurogenic bladder is associated with your type 4 disease, that is your Anderson disease, guys. Okay, what was type C? C was Courage disease, that was due to debranching, and Anderson is due to branching enzyme deficiency. This we have already discussed in our biochemistry rapid revision wala video. Now coming on to the forensic. Okay, so basically this Christmas tree stain, okay, it is used to identify the seminal stain. Okay, that is to identify the spermatozoa, whether on the dried clothes, on the means if there is a rape charge, so is there actually semen stain present on the clothes? That is used to know, that is Christmas tree stain. Now when we are doing the Christmas tree stain, we should not miss out other two important stain that may be tested upon. So one is this one is the Tickman stain, another is the Takayama stain. So this Tickman stain is also known as hematine crystal test. Okay, and what do we see here? It is brown colored cluster, that is brown colored rhombic crystal that you need to know. And this Takayama stain, okay, that is your hemochromosome test. And here what do you see? This Takayama is basically your pink colored feathery crystal. Okay, so how you can remember this, guys? Okay, this that is mother wala thing. Okay, girls. Okay, so mother girls, okay, they like pink color thing, that is pink colored crystal is your Takayama wala thing. So other one is that Tickman wala thing. Okay, man like white, black, brown, this colors. Okay, that is brown colored crystal that is seen here in Tickman test. Again an important thing, this both are microcrystal test for testing the blood. Again an important MCQ that you need to know. Now moving on to your next syndrome. Okay, that is your Felty syndrome, guys. So the mnemonic here is Santa. Okay, S is for splenomegaly, A is for anemia, N is for neutropenia, T is for thrombocytopenia, A is for arthritis, that is basically your rheumatoid arthritis. So again this is important. Okay, this may be asked, which one of the following is not a part of Felty syndrome? Okay, and 4 options could be given. Again an important MCQ that may be tested upon, guys. Okay, now coming on to the some PSM also. Let's see, if we talk about the normal distribution curve, guys, that is a Gaussian curve or a bell-shaped curve. Again important. So if you talk about the Gaussian curve, okay, that is mean median is equal to the mode. Okay, and for normal distribution, mean is the best measure of central tendency, and if the data is a skewed data, that is then median is better in both of them. Okay, now see, this is basically the bell-shaped curve. Do you see? So between the +1 and -1, guys, we have 68% population lying. Between -2 standard deviation to +2, that is 95%, and that is 99.7%. Again this thing you need to know. Okay, now see, if we talk about the bimodal distribution, means there is 2 age of peak, that is in Hodgkin's lymphoma, that is in 20 to 30s also, and 60 to 70 also bimodal peak. Then if we talk about the positive skew and negative skew, so this is always frequently we get confused, what is positive, what is negative. So how I think, so if we see these two photo, guys, here this looks more negative. Okay, and we are trying to ascend up, so we will go from ascending to descending order, guys. Mean सबसे small, then you have C median उससे big, then you have mode if you arrange it in ascending order. So negative skew, that is maximum is the mode. If there is positive skew, you guys just do opposite. Okay, just will change the arrow. I think this helps you remember the positive and the negative skew, the two frequently forgotten things that you see. Okay, now coming on to the other one. Okay, that is your facial nerve, that is Bell's palsy. Bell is important in Christmas. So what happens in Bell palsy? So in Bell's palsy, basically it is due to either this develops after the HSV, herpes simplex virus ka reactivation. Also it may be due to Lyme disease, herpes zoster, that is known as your Ramsay Hunt syndrome, sarcoidosis. Okay, so remember, this Lyme disease is the cause of bilateral facial palsy, again a MCQ. Okay, when we are doing this space, we should not leave this common cranial nerve lesion. Okay, so see, what happens, we have two things. This mnemonic you might have heard somewhere: 12 plus 5, 10 plus 7, both make 17, guys. But if there is a lesion in 12th and 5 cranial nerve, that is on the same side, and if there is a lesion in 10 plus 7 cranial nerve, that is on opposite side. So how I have remembered, 10th means in Roman number you like 10, and X also has 10. Okay, so they have moved apart from you. See, that is opposite. So 10 plus 7 will go opposite. 10th, if you know, because 17 you need to make total, so you need to add 7. So 12 plus 5 is the same side. This is again important that you need to know. Also you can remember like this, 5 and S looks same. So this is important that you need to know for your exam aspect. Okay, they may ask you. Then this is the upper motor neuron lesion and lower motor neuron lesion. Okay, so see, first of all thing, guys. Okay, this upper motor neuron, okay, this they have a bilateral innervation in the upper half of the face. So if you have a upper motor neuron lesion, upper half is spared due to bilateral innervation. So only the lower half is affected, and that also the contralateral side. And lower motor neuron ipsilateral, complete upper plus lower face is affected. This is again an important thing that you need to know here. Okay, this is about the Bell's palsy. Now moving on to the snowstorm appearance, guys. Okay, so this snowstorm appearance is seen in your ultrasound, that is seen in your hydatiform mole. So what happens in hydatiform mole? So there is a swelling, there is the cystic swelling of the chorionic villi. And how does patient describe it? That is passage of grape like clusters. This is again important. So patient presents with vaginal bleeding, emesis, okay, hyperemesis gravidarum, uterine enlargement much more than expected. Why? Because there is a cystic swelling of the entire instead of incomplete mole, like there is complete cystic swelling. So there is no fetus part, so it has grown much more than the height of gestation. So that is your hydatiform mole. Okay, this is associated with there is excess of beta hCG because it produces hCG. And these patients can also have hyperthyroidism because alpha unit resembles here, hyperemesis gravidarum, theca lutein cyst. Okay, before 20 weeks of treatment, you need to terminate the pregnancy. So that is dilation plus curettage. And your methotrexate, if you remember the methotrexate mnemonic, that mnemonic was cancer, C for choriocarcinoma. Okay, then again you need to remember, and you need to monitor serial monitor of beta hCG level. Now talking about your complete mole and the partial mole. So this complete mole, they are the most common. Okay, so that is 46XX or XY. Here what happens, here the ovum is empty, sperm only duplicate here. Okay, that is there is a single sperm. Okay, and most commonly there is nucleate egg, that is empty egg. And here you have 2 sperm 1 egg, that means 23 23 23 69. So see, here you will have hydropic villi and you have diffuse proliferation. Okay, and here only some villi are hydropic because there is complete mole, there is no fetus. If you see, guys, here fetal part are absent, so they have proliferated extensively. Okay, and here partial mole, partial fetal part. Remember partial mole, remember P57 positive, PPP. Uterus size is more because there is complete mole. Okay, SCG will be more high in complete mole. And this looks like a grape of cluster of grapes or snowstorm on ultrasound appearance, again important. Okay, this complete mole, okay, they have a 2% chance of choriocarcinoma, and in risk of invasive mole is 15 to 20. Means complete mole, everything is worse here in complete mole. Okay, that was about your complete mole. Now moving on to the stars. Okay, so we have this one. Okay, that is your starry sky appearance, which is seen in your bucket lymphoma. Okay, so this starry sky appearance, again this is a classical photo that you get, that there is a history of jaw swelling in an adolescent. Okay, so there is a translocation 814 in your bucket lymphoma, guys. Okay, you can remember like this, B looks like 8. Okay, so translocation 814, and on 8 chromosome there is CMYC, and on 14 chromosome you have IgG ka chain. So that is starry sky appearance. This is, and there is tangible body macrophage, again an important thing that you need to know here. Okay, this is the classical, this jaw lesion, and there would be some Africa ka history. Okay, very classical history that you need to know. Now moving on to the next one, that is post-infectious glomerulonephritis, PSGN, guys. Okay, after a streptococcal sore throat infection. So here also it looks like a starry sky appearance in your immunofluorescence, again an important thing that you need to know. Okay, now moving on to the next one, that is if you see the chest x-ray. Okay, and if it looks like a means either a figure of 8 appearance or a snowman appearance, so this is basically your supracardiac TAPVC. When we are revising this x-ray, let's complete all the important chest x-ray that we need to know in this go only. Why to leave it, guys? Okay, see, then this one, if you look, guys, okay, so this looks like a water bottle or the money bag appearance that is seen in your pericardial effusion. Now moving on to the next one, if you see this looks like a box shaped heart. Okay, you have put a box here, so this is seen in your Epstein anomaly, again important, and this Epstein anomaly is due to lithium toxicity if taken in pregnancy. Again a MCQ that may be tested upon. Okay, now then boot shaped heart. Okay, this boot shaped heart, if you look, guys, okay, this boot shaped heart is seen in the tetralogy of Fallot. Okay, if you reverse it, guys, that is FOT, foot. Okay, so that is boot. Okay, that is, so what are the what is seen in tetralogy of Fallot? So we have four things. Okay, remember the mnemonic PROV, that is P for pulmonary stenosis, R for right ventricle hypertrophy, O for overriding of aorta, and V for ventricle septal defect. Again, an important thing that you need to know in your this tetralogy of Fallot wala thing. Now moving on to the agonisting, guys. Does it look like a agonisting appearance? That is seen in your transposition of great arteries. Again, important. Okay, then this is again snowman appearance, figure of 8, supracardiac TAPVC. Okay, and we have infracardiac TAPVC also, guys, where we see ground glass appearance. So you can remember, snow you see above, guys, that is supracardiac, ground is below, that is infracardiac TAPVC. The same thing that is written here for you. Okay, now see this appearance, if you look here, guys, okay, this looks like a short. If you look carefully, guys, this looks like a short. So this is again important. So this is your scimitar sign that is seen in PAPVC, that is partial anomalous pulmonary venous connection. Again, an important thing that you need to know. Then see, this is looks like a sitting duck sign that is seen in your persistent truncus arteriosus. Again, an important thing. Then coarctation of aorta. Okay, that is figure of 3 appearance. Okay, so here you have figure of 3 appearance and you have inferior rib notching. Both of them are important here. Okay, then you have egg in cup appearance, guys. Okay, so this is seen in your constructive pericarditis. Again, an important question that may be tested. Then if you see, guys, this is a gooseneck deformity that is seen in your endocardial cushion defect. Okay, again, an important thing that may be tested. Then if you see this x-ray, guys, okay, this the where it is highlighted, guys, okay, so this looks like a inverted mustache sign that is seen in your mitral stenosis. Okay, this inverted mustache sign is also known as your antler sign. Again, an important thing. Then see, what are the chest as x-ray finding in your mitral stenosis? So MS, you can remember like Mahendra Singh Dhoni, and MS we can recollect so back to Chennai Super King. So let's remember with the mnemonic Chennai Super King. Okay, so see, C for cardiomegaly, it looks apparently big. Okay, C for calcified mitral valve. S for shadow within shadow, that is known as double shadow. S for straightening of your left heart border. Okay, this left heart border gets more straightened. Okay, S for splayed carina. S for stag antler sign, which we have already done, that is your inverted mustache sign. Okay, and K for curly A line, B line, and curly C lines. Okay, so you can remember very easily with this mnemonic, that is Chennai Super King, cardiomegaly, shadow within shadow, splayed carina, straightening of left heart border, and curly A line, B line, C line. This is your chest finding in your mitral stenosis. Okay, so guys, this was all about your Christmas. Also, not only we have talked about the Christmas, but we have talked about other important things that may be tested upon. All the chest x-rays, guys, has been discussed here. So guys, wish you a Merry Christmas and a Happy New Year. Enjoy your day, guys. Happy learning. Please subscribe to the channel and do comment if you like the video. Happy learning.